It's a Tuesday morning in Onamia, Minnesota. Inside the Mille Lacs health system, the emergency room is humming. Nurses are checking vitals, heart monitors are beeping, and the beds are full. But in a quiet office down the hall, an administrator is staring at a laptop screen. She clicks refresh on a federal billing portal for the 20th time today. The screen doesn't show a payment confirmation or a process claim. It shows two words in a generic red font: technical error. This isn't a temporary glitch or a scheduled maintenance window. For weeks, this single, non-responsive digital interface has been the only thing standing between the hospital and total insolvency. Every single Medicare claim filed by the facility has been flagged with the same frozen code. The federal government has effectively halted payments to Onamia's only hospital. There is no manual override, no physical office to visit, and no one with the code to fix the gateway. On March 26, 2026, the warning becomes official. A critical technical glitch in a newly implemented billing system is forcing a functional medical center toward imminent closure. A town of thousands is about to lose its only emergency room, not because of a lack of patience or a failure of medical skill, but because of a technical error on a website it has no authority to fix. Here is how this. To understand how a hospital runs out of money while its beds are full, you have to look at the plumbing of American healthcare. Mille Lacs Health System is the only provider for miles around Onamia, Minnesota. Like most rural facilities, it survives on a steady pulse of federal reimbursements. In early 2026, that pulse was handed over to a new, modernized Medicare billing system. The project was sold as a way to eliminate the friction of the old, fragmented databases. A single, streamlined federal billing platform. One interface to manage every claim, every patient, and every dollar. The promise was total transparency and faster payment processing for providers on the front lines. For the administrators in Onamia, it meant trading filing cabinets for a high-speed digital gateway. But this modernization created a single point of failure. A rural medical facility's entire operational budget was now tethered to a server it didn't control. There is no manual override for a federal software update. No local official can sign a paper check when the billing software refuses to authorize the transaction. By the time the first red flags appeared, the hospital had already migrated its entire financial life into the new portal. It was a critical technical glitch waiting for a victim. And in Onamia, the system began to halt payments without warning. The interface was no longer a tool for healthcare. It was a technical error that carried the weight of a death sentence. At the hospital in Onamia, the physical work never stops. But every time a bill is sent into the digital void, the response is identical. A red banner at the top of the federal billing interface. Technical error. The administrators at Mille Lacs Health System aren't just looking at a bug, they're looking at a wall. They try to find a person behind the platform. They look for a manual override, a way to mail a physical form, or a phone line that doesn't lead to a recording. But the modernized Medicare billing system was built to eliminate the human element. There is no backdoor for a rural clinic when the central gateway freezes. The hospital's balance sheet shows a terrifying number: 0 federal reimbursement. The critical technical glitch has effectively halted payments to the entire facility. It's a systemic absurdity. A functional emergency room, staffed by doctors and filled with patients, is being erased by a database migration error. There is no code to fix it from Onamia. There is no authority to bypass the billing software from the state level. The hospital is physically perfect, but digitally, it has ceased to exist. The imminent closure isn't a medical choice, it's a programmed certainty. The crisis in Onamia isn't an isolated incident. It's a symptom of a national infrastructure that's becoming increasingly brittle. In October 2025, an Amazon Web Services outage ripples through New York, knocking out services for millions. A week later, South Dakota suffers a 2-day state IT blackout. The official investigation into the shutdown finds something embarrassingly simple. The cause: mislabeled wires. A single physical mistake in a server room paralyzing an entire state government. In Waterbury, Connecticut, the failure is even more visceral. A 6-day water system outage forces the city into emergency repairs on a grid that hasn't seen an update in decades. By January 2026, the San Francisco Board of Supervisors is through with explanations. They blast PG&E and call for a public inquiry into the reliability of the city's utility system. But while the politicians demand answers, the bank account in Onamia stays at zero. The technical error in the Medicare system hasn't been patched. Administrators at Millax Health System are left navigating a financial crisis they didn't create. The halted payments have become a terminal diagnosis, not because the hospital ran out of medicine, but because the federal billing platform has effectively deleted their ability to function. The physical infrastructure is still there, but the digital permission to use it has been revoked. Today, the hallways in Onamia are still clean, the beds are still made, and the heart monitors are still plugged in. But the administrative offices are quiet. The warning of imminent closure from the Millax Health System wasn't a threat to get attention. It was a simple statement of math. In South Dakota, they eventually found the mislabeled wires that killed the state's IT for 2 days. In Waterbury, the 6-day water system outage ended with a series of emergency repairs. But for the only emergency room in Onamia, there is no physical wire to relabel and no pipe to patch. The new Medicare billing system remains a black box. Every morning, an administrator still logs in, hoping the technical error has been replaced by a green checkmark. It hasn't. The financial crisis continues, not because of a medical failure, but because of a critical technical glitch. In the corner of the empty emergency room, a state-of-the-art diagnostic monitor flickers in the dark. It isn't showing a patient's pulse or a scan of a broken bone. It just displays a single, repetitive message: connection lost.